Approach and react to people in mental health crisis. Introduction. We will look at what a mental health crisis is and how one can be recognized. We will also explore the mental health crisis intervention process and then go on to discuss how you can help someone who is having a mental health crisis. We will talk about listening and talking strategies and organizations who may be able to help with various aspects which feed into mental health crises. Topics to be covered in this module: definition of mental health crisis, recognizing mental health crisis, mental health crisis intervention process, 8 tips for talking about mental health, crisis intervention model, the ALGI action plan, useful organizations and resources. Definition of mental health crisis. This is a situation in which the person experiences intense emotions, behavior, or psychiatric responses triggered by something which has happened in the past. It is non-life-threatening. The person may be unable to function properly, or might be highly agitated, disorientated, and may be a risk to themselves or others. Mental health crises can be caused by high stress levels, conflicts, trauma, etc. People with mental health conditions are more likely to suffer from mental health crises, but anyone can experience them. Often, a crisis may precede diagnosis. A mental health crisis that is not dealt with at the right time could develop into a mental health emergency. Proper treatment can reduce the chance of future crises occurring. Recognizing mental health crisis. Recognizing mental health crises can help both clinicians and the public recognize when one is occurring. Some of the risk factors which may predispose a patient to a crisis include substance abuse history, pessimistic view of life, poor or lacking emotional awareness, physical or developmental challenges, poor social support group, poor coping skills, lack of self-esteem, ongoing illness, injury, poor diet, poor sleep, chronic pain. Symptoms may be physical, psychological, and interpersonal. Physical include skin problems, compromised immune system, headaches, muscle tension, poor sleep, cold hands or feet, sweating, pain in the back, neck, or jaw, loss of appetite, cramps, heartburn, etc. Psychological include fear or anxiety, irritation, sense of hopelessness, sense of helplessness, nervousness, impatience. Interpersonal include road rage, argumentative, frequent conflicts, work issues or job instability, isolation from social group and activities, violence at work or at home. Mental health crisis intervention process. An intervention is intended to offer short-term, quick help to someone who is experiencing emotional, behavioral, physical, or mental distress in response to something. Interventions must be done carefully so as not to worsen the situation. Mental health first aider needs to think about a variety of things, including communicating well. You must practice listening actively. This means remembering what is said, observing the patient's behavior, hearing their words, and avoiding judgment or subjectivity. Being encouraging. This involves showing the speaker that you are interested. It might be verbal, through short phrases such as really, and I see. It might be non-verbal, such as nodding, smiling, and sometimes using eye contact. Eye contact can depend on the individual, and what they are comfortable with, so this will have to be assessed. Your posture can also show interest, through leaning forwards, tilting the head, and possibly mirroring the speaker's posture or speech patterns. Clarifying things. This involves paraphrasing things which have been said and checking that the intention of the words is correct. It might involve phrases such as "you are saying," "do you mean," or "can you explain?" You must avoid being judgmental or too direct. You should rephrase in simple terms and watch the speaker, see if they agree with the rephrased statement or not. Offering emotional labels. Someone who cannot label their emotions often struggles more to control them. Offering labels help the speaker know you are hearing and understanding them. You might say something like, "You sound as though you are feeling angry. Have I got that right?" Open questions. Asking questions can encourage talking, but they should be open. You should avoid asking speakers why or yes or no questions. Good questions might be, "When did this happen? What did you do next? What did you think?" Power of silence. Sometimes, quietly sitting is the best way to get someone to talk. Silence can also be used to show respect for the speaker, or to emphasize something important just before or after you say it. 8 tips for talking about mental health. Talking is the best thing to do when you think someone is going through something difficult. It isn't always easy to know what to say, however. Here are 8 things you could do, which might make it easier. 1. Make a time. Having time and space, where there aren't distractions, will let the person know you value what they have to say, and will ensure they don't feel rushed. 2. Don't push them. They shouldn't feel they have to tell you things they don't want to tell you. Let the speaker set the pace. 3. Keep language neutral. Keep the language neutral, and encourage them to tell you how they feel, rather than trying to guess or infer. Don't ask too many questions. 4. Discuss well-being. Talk about their lifestyle, and how a good diet and healthy exercise can help with mental health issues. Ask if there is anything they find useful in terms of reducing stress. 5. Listen carefully. Even if you don't agree, respect them enough to let them talk, and to hear their perspective. Repeating their words back show you are listening. 6. Ask if they want assistance. Seeking professional help. You could offer to go to appointments with them, or help them talk to others. Make sure they stay in control. 7. Don't second guess. Let them talk, rather than jumping in with solutions or assessments of your own. 8. Know when to turn to professionals. If you think the person is in danger, or you are out of your depth, seek help from professional bodies. Crisis intervention model. There are several models for addressing a crisis, but Roberts' 7-stage crisis intervention model is the most commonly used. As the name suggests, the model has 7 stages which an individual must go through. These are: 1. Assessment. This involves looking at the major physical, psychological, and social issues which the person suffers from. It should look at a patient's medical history, their drug history, their environment, and what sources of support are available, e.g. family, hobby groups, professional support. Coping methods should also be assessed, along with their strengths and needs, and how well they can take care of themselves. The assessment should also look at the risk of suicide, past history of suicide, and other risk factors which might contribute, like recent losses. It may be necessary to involve emergency services. 2. Establishing rapport. This often happens during stage 1. This is about conveying respect and establishing trust with the patient. The clinician needs to understand the patient's situation, listen to verbal and non-verbal cues, and express empathy. 3. Identify major problems. It's important to look at what led to the crisis. Other problems should also be discussed, and issues should be prioritized. 4. Discuss emotions. The patient should be allowed to discuss their emotions and feelings, that others understand them. A mental health first aider may be able to help patients reform their thoughts or challenge wrong ones by asking things like, have you experienced this in the past? Has it ever been wrong? Or what could you do to check if this is true? 5. Explore treatments. You should look at how the patient's self-esteem can be increased and how problems can be addressed. The patient may struggle to look at the big picture and cling to coping mechanisms. You should encourage them to think about how their current situation could be improved. Looking at what has helped in the past may be useful. The patient should be in control of the brainstorming session as much as possible. 6. Form a plan of action. This stage is about helping the patient understand why the crisis happened and creating a plan for the future. The patient must be able to work through and come to terms with the event so they can move on. The action plan might involve joining a support group, going to a shelter, etc. 7. Plan follow-up. Decide how you are going to follow up to make sure the treatment is working and that the crisis has been resolved. If the crisis was tied to a particular date, follow-ups should be done at the 1-month anniversary and 1-year anniversary. Many of these steps may overlap with each other. The ALGI Action Plan. This acronym describes a process by which a mental health crisis can be assessed and help offered. A. Assess for suicide or harm risk. How are they behaving? Are there any sudden changes? Assessing the current state is important before you confront the person and try to help them. L. Listen. This must be done in a non-judgmental way. The first aider should not listen for the sake of answering, but just for the sake of letting the speaker talk about their feelings. G. Give encouragement. This will not always be easy, but offering encouragement to someone who is suffering may be enough to get them through. Reminding them that they are not alone and making them feel someone believes in them can make a big difference. E. Encourage professional help. Many people hesitate to seek help for a whole variety of reasons, not wanting to be a burden, not sure their problems are severe enough, etc. If you have established a rapport with someone, they are more likely to listen if you encourage them to get help. E. Encourage self-help. The person may be able to pick up hobbies or activities that will help them feel better. You will likely meet some resistance when suggesting this, but it should still be attempted. Consider what you might be able to introduce them to, or how you could include them in social groups. Useful organizations and resources. As someone who deals with crises, you might need to put patients in touch with more long-term mental health services which can help them. These include the community mental health team, which may have a 24-hour service. They can be contacted via local social services or a social work team. Mind Infoline, who work with local people from 9 a.m. to 5 p.m. They can be contacted at 030012333393 or click the link. Samaritans, who offer 24-hour emotional support and can be contacted at 116123 or click the link. Citizens Advice. They provide free, confidential, independent advice on various problems and can offer information about rights or responsibilities. Anxiety UK, who run helplines with staff who have personally experienced anxiety from 9:30 to 5:30, Mon to Friday. Their number is 084447757774. Minded, which is a free resource for educating people about children and youth mental health. Rethink advice and information service provide guidance on specific issues. They can be contacted at 030050000927 or click the link. Step Change, who offer advice to people who have debt problems. They can be contacted at 0800 138 1111 and have a site. Click the link.